Welcome to the Infidelity Doctor channel. I'm Dr. Talal Al-Salim, and this is the Ask Dr. Talal segment. You'll place to ask me any question you want to know about affair recovery and affair prevention. Please remember that this is not a substitute for the counseling that you're supposed to be getting. This is merely a place for you to get some basic questions answered and hear about my clinical insight when it comes to affair recovery and affair prevention. So before we get to the question of the week, make sure that you like the video and subscribe to the channel so that you can get the most recent update. All right, so the question of the week is as follows. How long should I go to therapy, and how do I know if it's actually working? It's a great question to ask. So the first thing I'm going to say is after the discovery of infidelity, therapy should not just mean couples therapy. Yes, you need to be engaged in couples counseling and specialized infidelity recovery couples counseling, but also you need to be considering individual counseling as well. Because both the betrayed and the unfaithful are going to be needing an individual support that they're not able to provide to one another while they're trying to heal from the trauma of infidelity. More importantly, you also want to consider family therapy, especially if you made the mistake of involving your kids about the discovery of the infidelity. And that's why I always encourage my clients, when you are discovering infidelity, you should not be letting your kids know about it, because that could cause additional problems for them, problems that may not be at an age that they can actually cope well without causing long-term damage when it comes to future relationship they will have with others. So not only you need couples counseling, you need individual counseling and possibly family counseling if the kids have been exposed to the parental infidelity. But also, we need to talk about what is the purpose of infidelity recovery therapy. So the goal of infidelity recovery therapy is giving you the space that you need to help you make sense of what happened, why it happened, assess the damage, and figure out what's the best way to heal from this, which could mean healing together and repairing the relationship, or it could mean healing individually, because not everybody's going to be able and willing to do the work needed to repair trust. So that is the goal of couples therapy or infidelity recovery therapy in a couple format, which means that if that's the goal, it's going to be a lot easier for you to assess whether or not the therapy process is actually achieving those objectives. When it comes to how long does it take, I always encourage people to think about that each journey is going to be unique and different based on the different factors that have led to infidelity. So rather than focusing on a specific time frame, focus on specific milestones and objective that you want to achieve, regardless of how much time it takes to get there. If you want general numbers, I would say the shortest period of recovery that I have witnessed was around 6 months. The longest period that I have seen was about 2 years and a half. And this is, the type of situation where there was a lot of complication. But again, each person, each relationship is going to be different. But also I encourage you, when you seek the specialized couples counseling to deal with infidelity, is to make sure that you develop some outcome measures that you and your therapist have to track. And then this gets tricky too, because sometimes people mistake normal parts of healing as lack of progress. A common example I see when people are dealing with triggers, which is going to be a byproduct of the trauma of infidelity, sometimes the betrayed and the unfaithful feel that their therapy is not working because they're still dealing with triggers. Well, no, you could be healing and still dealing with triggers, because triggers are just part of the recovery process that you need to heal through. It's how you handle the triggers is going to determine the future frequency and intensity of their occurrences. So, and that's why the value of being able to have specific concrete outcomes that you and your therapist can agree on as measurement of your success. So hopefully this answered the question of the week. Feel free to leave your comments in the comment section below about the answer that you heard today, as well as suggestions of questions that you'd like to see me answer in the future. Until then, be well, be safe, and embrace the possibility for a brighter future. Take care.